In our reporting, we always include all deaths that have COVID as either a primary or secondary cause of death, according to the healthcare teams that were involved in the cases. For example, a primary cause would be someone in whom COVID infection progresses to pneumonia, and this is the direct cause of death. A secondary cause could be a case where someone with a severe underlying illness, such as heart failure, gets COVID, and the infection makes their pre-existing condition worse, leading to death. We report in this way to accurately capture the impact that COVID-19 is having. That is also why our reporting process includes both deaths that come to us where a person has COVID listed as a primary or secondary cause of death, as well as cases with a recent diagnosis of COVID where the cause of death is still under investigation. To make sure we are as accurate as possible, after a death is reported, if there is uncertainty, it is reviewed to validate our information. If that review identifies that COVID was not a primary or secondary cause of death, it is removed from our totals. Every surveillance system has to balance this tug-of-war between precision and timeliness. The more precise reporting is, the slower it is. We have chosen to focus on being as timely as possible in the interests of transparency. Sometimes, though, as in the case reported on Tuesday, the initial information provided to us changes after a review. While the initial report of the death of the 14-year-old included COVID as a secondary cause, we have now received additional information that indicates COVID was not a cause of death. As we routinely do with all similar reviews, when this happens, we remove the death from our reporting. This incident has caused suffering for many, and again, I apologize for this. We are making changes to prevent similar situations in the future. Going forward, we will not publicly report any COVID deaths in anyone under 18 until the review process has been completed. We will prioritize accuracy over timeliness in these cases. To those who believe that the numbers are not accurate, I would say that the process that we follow takes very seriously the responsibility of ensuring that the deaths that we report do have COVID as either a primary or secondary cause. So if someone dies from a car crash or another cause that is clearly not COVID, they are removed from our deaths and they are not counted. So again, recognizing that it would be convenient to believe that COVID does not have the impact that it does. We've clearly seen that our COVID deaths track not only with the number of cases we have. So if our COVID deaths were being driven predominantly by deaths that happened from other causes where someone happened to be diagnosed with COVID, we would expect our deaths to exactly mirror our waves. And yet if you see our deaths that happened in our second wave, our third wave, and our fourth wave, they are dramatically different. We had very few deaths in our third wave, where we had significant protection. We weren't yet seeing the Delta variant and the impacts that has had. And so if it were true that our deaths are again, mostly about chance diagnosis of COVID and then causes of death due to other causes, the ratios would be very similar. And in fact, they're not. Deaths in the third wave were low. Deaths in our second wave were the highest before we had vaccine available, and deaths in this fourth wave are in the middle of those two, which again shows that as we have a consistent reporting process over time, we are capturing those deaths that are due either primarily or secondarily to COVID.